Hello everyone, welcome back to the channel, that is AMS MBBS lectures. In today's session we're going to continue the same topic, that is HIV and AIDS under CVS Microbiology, and this is going to be the fourth part wherein I'm going to discuss the laboratory diagnosis, and also we'll try to cover these three related topics in this same video, guys. Okay, so let's have a look on lab diagnosis. Now before going on to the different types of tests that are available, you should always keep in mind about the following three C's whenever we are dealing with the HIV patient, guys. Okay, so the three C's stand for C, that is your consent, confidentiality, and counseling. Okay, now why all this thing is important? Because guys, there is a lot of social stigma associated with HIV and AIDS, so you should always make sure that you are going to take the proper consent, keep the information confidential, and also counsel the patient of HIV, guys. Okay, now what do I mean by consent? Consent is nothing but you should always obtain the written consent from the patient. Okay, so a written consent should be taken from the patient, and you should always explain the whole procedure as well as the nature of the test that you're going to perform to the patient. So explain the nature of the test to the patient that you're going to perform. So you have to explain the nature of the test. Next thing is you have to maintain the confidentiality. Means you should not reveal the name of the patient. So whenever you are going to provide the report of HIV, guys, the HIV ka jo report if you are providing, it should not have the name of the patient. Okay, the report should not have the name of the patient, should not be mentioned. And also, guys, the term HIV positive, okay, HIV positive, this particular term should also be not written onto the report of the HIV, guys. Okay, and lastly, you should also counsel the patient, because counseling is going to motivate the patient. Okay, will motivate the patient to tell about his condition to his or her own family members as well as the spouse. Okay, and also counseling will help induce behavioral changes. Okay, it will help induce behavioral changes in the patient. So always whenever we're dealing up with an HIV patient, we have to make sure that the following three C's, that is consent, confidentiality, and counseling, is properly done, guys. Okay, so next thing, that is, these are the important set of tests that are we doing for the HIV detection, guys. Okay, out of all of this thing, the mainstay of the diagnosis, okay, the mainstay for the diagnosis, the mainstay for the diagnosis of HIV are nothing but your antibody detection test. And under antibody detection test, we have two things. We have the supplemental test and the screening test. Under screening test, we have your ELISA, enzyme linked immunosorbent assay, or we can go with the rapid or a simple test. Now under supplemental test, we are having your western blot assay, or we can do a line immunoassay, guys. Then another set of tests, those are your confirmatory tests, and confirmatory test includes your P24 antigen detection. Okay, we can do a viral culture, or simply doing a viral RNA or viral DNA detection. And some last category, that is just some non-specific tests or immunological tests that we can perform, is nothing but your, we can check the CD4 T cell count. Okay, we can look for the presence of some abnormal proteins like your neopterin and beta macroglobulin, okay, or a condition called as your hypergamma globulinemia can be checked in the altered CD4 CD8 T cell ratio. Okay, these are some non-specific findings to remember. Now let's discuss each of the tests in detail separately. Let's start with the first one, that is your screening test. Okay, so under screening test, you should be remembering, we, as I said, we have enzyme linked immunosorbent, that so immunosorbent assay, that is ELISA, and we also have the rapid or simple test. Now ELISA is taking nearly 2 to 3 hours, okay, for it to give you the result, whereas a rapid or a simple test will provide you the result like within 30 minutes you will get the result. Okay, within 30 minutes it will provide you the result. So these both of these tests, or in short the screening tests, are going to take comparatively very less time, and they're going to provide the result very quickly. Okay, now please remember NACO, guys. What is NACO? The National AIDS Control Organization. One of the AIDS control organization in India is NACO. So NACO recommends that we should be using those screening tests whose sensitivity is more than equal to 99.5%, and the test, okay, whose specificity is more than equal to 98%. Okay, so these like the जो भी screening test इनकी sensitivity and specificity are higher, they should be used. Okay, this is what is recommended by the National AIDS Control Organization. Okay, next thing, that is whenever we are performing a screening test, guys, the result of a screening test should always be confirmed by performing some other test, guys. Okay, we should never rely on the test result of a single screening test. Okay, why? Because of two reasons. Because first, there can be a chance of getting false positive results. Okay, we may get false positive results, or it can be because of technical errors. Okay, because of technical errors. So we should always confirm the uh, tests, okay, the screening test, by performing some other test as well, guys, because reason clear है, false positive or technical errors के वजह से. Okay, now the antigens that are we using in most of the screening tests, okay, are nothing but HIV1 specific antigens are your examples. If I give you over here, so we can remember, we have the P24 antigen, we have the glycoprotein 120 antigen, the glycoprotein 160 antigen, and we have the glycoprotein 41. So these are some HIV1 specific antigen, and for HIV2 specific okay antigens, we have one simple example, and that is your glycoprotein 36 is what you have to remember. Okay, so as I said, screening test में दो चीजें आती है, ELISA and rapid test. Now let's describe ELISA and rapid test separately, guys. Okay, so when I say ELISA, ELISA मतलब enzymed link. Okay, it simply means your enzymed linked immunosorbent assay. Enzyme linked immunosorbent assay. Now, this particular test is considered to be the most commonly performed, or the most common screening test that is performed at the blood banks as well as your tertiary care sites. Okay, tertiary care sites. So okay, in both of these places, guys, if you want to do a screening test for HIV, we can go with ELISA, guys. Okay, now there are different types of ELISA kits that are available. We all are having third generation kit. Okay, this third generation ELISA kit is using a recombinant or a synthetic peptide को use करती है, and it is used for the detection of HIV antibodies. Now, when it comes to the fourth generation kit, in the fourth generation kit, it is using a combination of two things. So, just like the third generation, it is also making use of the recombinant recombinant or synthetic peptide, which is helping in the detection of the HIV antibodies. And along with this peptide, it is also making use of the monoclonal antibodies, which is useful for the detection of the P24 antigen. Please remember that as a fourth generation ELISA kit is capable of detecting both the antibodies as well as the antigen. And which antigen? So it is detecting the P24 antigen, guys. Okay? And these two things, why I have just written the first and the second generation below, because first and second generation kits jo the, the first generation kit which was based on the crude HIV antigen, and the second generation ELISA kit was using again the same recombinant and the synthetic antigen को use करता था ये. Both of these tests we are now not used. Okay, these are have become obsolete. Okay, this is something that we don't use right now. We are mainly using either the third generation or a fourth generation kit. Okay, now when I say ELISA, guys, we are having different mechanisms or principles on which ELISA is working, and the names are mentioned over here. That is your indirect ELISA. Okay, so we all are having indirect ELISA, we all are having your competitive ELISA and the sandwich ELISA. So these are the different types. Okay, this is the information with respect to ELISA. Now let's go and have a look on the second screening test that is available, that is your rapid test or simple test. Okay, now it is rapid, yani it is giving you results within 30 minutes, less than 30 minutes. Okay, and these are very simple tests. Why it is a simple test? Because it does not require any special equipment over here, and it is the one of the most commonly used tests in India for screening of HIV, guys. Okay, now please remember that these tests, okay, this rapid test or simple test, these are available in different formats depending upon the different, okay, based on different principles. Okay, and those includes your dot blot assays, also called as the immunoconcentration technique or flow through method, and one of the example is the try dot test over here. Okay, The next principle, that is your immunochromatography or ICT, lateral flow assay. Then we all are having your particle agglutination assays using the latex, gelatins, RBCs. And last principle, that is your dipstick or comb tests, okay, which are nothing but your enzyme immune assay based test hote hai ye wale, okay. So these are the various principles in which the rapid or a simple test are available, guys. Clear with the screening test? So we have described the screening test completely. Now let's go and study the supplemental test, okay. Now please remember one thing over here, guys, that is we are going to perform the screening test. The screening test, as I said, the result of the screening test should always be confirmed. And for confirming the screening test results, we can go with the supplemental test. We can perform the confirmatory test, or we can simply perform another screening test itself, okay. We can go with another screening test itself. Understood? So far the information is clear, okay. Now let's go and discuss the supplemental test, guys, okay. Under supplemental test, guys, these tests is also what they are also your antibody detection methods ही माने जाते हैं, ठीक है. And as I said, they are used for the validation or confirmation of a positive result from the screening test. And just now I said this thing. Please remember that these supplemental tests जो होते हैं, these are a bit expensive, ठीक है. They require trained experts, labor intensive, a lot of people are required, and they also required expert people over here to interpret the results which are coming. And also, guys, there are chances that it can give rise to equivocal or indeterminate results. What do you mean by this thing? So results, so जहाँ से interpretation मतलब it is not very clear that the person is having, means you doubtful results. In simple terms, if I say, we can get some doubtful results also from this particular test. So these are some, you can say, kind of disadvantages or demerits of these supplemental tests. And two tests are named under the supplemental test. Those are your Western blot assay and the line immunoassay, of which I'm going to describe the Western blot assay in detail. Okay, so Western blot assay is based on, what is the principle on which it is based? It is based on the immunoblot technique. Immunoblot technique. Okay, so now under this test, what we are doing, guys, okay? So we are basically taking a nitrocellulose strip over here. So we are making use of a nitrocellulose strip को use करते हैं. Now this strip is having the HIV antigenic fractions, okay. So it is having the HIV antigens, okay. We are taking the patient's serum, okay. So in a container we have taken over here the patient's serum, and in which we are expecting that there should be the presence of anti-HIV antibodies, okay. Anti-HIV antibodies, I mean to say antibodies which are against the which are against the HIV antigens. Those are called as your anti-HIV antibodies is present in the patient serum. So एक nitrocellulose strip लिया है. This nitrocellulose strip, which is having the HIV antigenic fractions, guys, we are loading this strip with the patient serum over here, and suppose the serum is having the antibody, so there would be this antibody antigen reaction will take place, and you are going to, okay, and those are going to appear as distinct bands onto the nitrocellulose strip. And this is what is how we are going to do the Western blot assay. And for interpretation, we are having two criteria, the WHO criteria and the CDC criteria. And now for interpreting the result, okay, that how, when I'm going to say that how many bands should appear onto this particular strip, then only we can say that the result is positive, okay. So let's go and have a look onto the details of this particular test. ओके, सो यहाँ पे सारी डिटेल्स यहाँ पे एक्सप्लेन करी गई है. दैट इज ये वाला जो टेस्ट होता है वेस्टर्न ब्लॉट एसे, इट इज ऑल्सो वन ऑफ द टेस्ट विच इज गोइंग टू डिटेक्ट दी एंटीबॉडीज ओनली. एंटीबॉडी डिटेक्ट करता है. नाउ किसके अगेंस्ट एंटीबॉडीज डिटेक्ट करने वाला है? तो इट इज गोइंग टू डिटेक्ट एंटीबॉडीज अगेंस्ट द एंटीजेनिक फ्रैगमेंट्स ऑफ HIV. Okay, and this test, that means that this test is capable of detecting the antibodies to the GAG gene products, okay, that is your P55, P40, P24, P18 antigens, then antibodies against the pol gene products, that is your P65 or 66, P55 or 51 and P31, And these are all the names of the antigens that are present in the nitrocellulose strip, okay? And also the antibodies to the ENV gene products, that is the glycoprotein 120, GP160, and your GP41 antigens, guys. Take care. And as I said you that if if the antibodies are present, then the antigen antibody reaction will take place, and you will be getting those antigen antibody complexes which will appear as distinct bands where onto that nitrocellulose strip, guys. ठीक है? So ऐसे एक strip जैसा होता है. This is a strip test. Okay, एक strip होती है and इसके ऊपर you will be seeing, okay, at multiple at different sites you can see those bands which are appearing if the reaction has taken place between the antigen and the antibody, guys. Okay, now how we are going to interpret this result? Okay, so what are those conditions? So there are two criteria for interpreting the result, and that is your WHO criteria and the CDC criteria. Okay, so we have the CDC criteria and the WHO criteria. So if I'm saying that out of all of these, okay, जो ANV genes की जितने भी antigens हैं, if you are getting, okay, any of these two bands positive, so if you are getting two ENV bands, okay, at least two envelope bands with or without the presence of a gag or pole gene band, you say it is positive according to the WHO criteria. Yes, we can say that the test is positive. Okay, and according to CDC criteria, guys, CDC criteria के हिसाब से we should be having at least two bands, okay, out of the following four antigen: the P24 antigen and your glycoprotein 120, glycoprotein 160, or glycoprotein 41. So out of these four antigens, if at least two of them are coming positive, so according to the CDC criteria, we can say that the Western blot assay is positive. The test is positive. And according to WHO, guys, दो envelope bands होने चाहिए with or without the gag or pole gene bands. Is it clear? The criteria over here is clear. So that was all about the supplemental test, guys. Okay. So I have described so far the screening test as well as the supplemental test. Now let's go and study the confirmatory test over here. Okay. So confirmatory test, okay, includes this following four tests. Let's describe the first test, that is the P24 antigen detection test. Okay, now for understanding this test, you should be knowing that this particular antigen, when it is becoming detectable, for how long it is remaining detectable. So this is something that you should be knowing. Okay, so please remember that this P24 antigen becomes visible by 12 to 26 days after infection. 12 to 26 days after the infection, your P24 antigen becomes detectable, and this lasts for nearly 3 to 4 weeks. Okay, it is going to last for nearly 3 to 4 weeks, and then uske baad the levels of P24 antigens are again elevated. When they are elevated again during the late advanced stages of HIV, during the late advanced stages of HIV. And what do I mean by this late advanced stages? Means I'm talking about AIDS. Okay, we are talking about AIDS. This is okay. So during the late stages also, during the period of AIDS also, it is this P24 antigen that will again, their levels would be elevated. Okay, please remember this test is a bit less sensitive. Okay, this test is less sensitive, that is the sensitivity is nearly 30%. Okay, so yes, detecting P24 antigen test is a bit less sensitive test. So what are the uses of this test? The first thing, it's a confirmatory test. It is used for the confirmation of the diagnosis of HIV. It is also useful in the diagnosis of HIV during the window period. Now what is this? This is another, okay, now what is window period? I will be describing this, okay, at the end of this session. Shortly we'll be describing what is window period and what are the various tests that we can use to diagnose HIV during this window period. Okay. Next thing, it is also helpful in diagnosing the late stage of HIV. Why late stage of HIV or AIDS के अंदर again detection के लिए you can go with this thing, because as I said, during the late stages the levels of P24 antigens are again elevated. So therefore it is also one of the indications that it can be used for the diagnosis of HIV during the late stages, and this is because of the immune collapse or also for the CNS diseases which is taking place at the late stages, guys. Okay. Then it is also used for the diagnosis of HIV in infants, but again it is not very reliable, guys. And then comes the next point, that is, yes, to monitor the progress of HIV, to resolve the equivocal Western blot results. And as I said that whenever doing a Western blot assay, there are chances we can get indeterminate or equivocal results आ सकते हैं. And to confirm that thing, we can use a P24 antigen detection test over here. है ना? So these are the various uses and some information regarding the P24 antigen detection test. Let's go to the next one, that is called virus isolation from the blood or tissue. I mean to say we are studying the viral culture. Okay, we are going to talk about viral culture. That is how we are going to isolate the virus from the blood or the tissue. This is also one of the confirmatory methods that we can make use of. Please remember that is this viral culture, okay, or this viral isolation जो ये method होता है, this is a very time consuming method, okay, it is a very time consuming method. That is, it is going to take more than equal to 6 weeks, okay, for the results to come. है ना, culture करने में it will take a very long time, right? Also, this test is expensive. Okay, this is a bit expensive test, and also this is not very sensitive. So can we use this thing as a routine diagnostic test? No. This particular technique, this viral culture, is something that we are using only and only for the research purposes. Okay, so this is used for the research purposes only and not used as a diagnostic test, guys. Clear? How are we going to do the viral culture? How we do the culture? So the method that we are using is called as co-cultivation technique. So we are going with the co-cultivation method. So method that we are using is co-cultivation technique. Okay, so in this technique, what we are doing, we are collecting the peripheral blood mononuclear cells, that is PMBC, from both the patient as well as from a healthy donor. And after collecting, we are co-culturing it. Okay, we are co-culturing this blood cells. Okay, PMBC को co-culture किया जाता है simultaneously, and then followed by this co-culturing, we are doing the detection of viral RNA or antigen in the culture suspension. So this was all about viral culture. The method that we're using is co-cultivation, and again, it is not a routine diagnostic test. It is only for the research purpose, guys. Okay, because it is a time-consuming test, expensive hai, and it is not that sensitive test. Okay, next test under confirmatory test is the viral RNA detection test. And please remember, this viral RNA detection test is considered to be as the gold standard test. Okay, it is considered to be as the gold standard test for confirmation of the HIV diagnosis. Okay, it's a gold standard test for confirmation of the HIV diagnosis. Clear with this information, guys? Okay, so never forget, it is a gold standard test. Okay, now this RNA detection test, this RNA detection test is something that is available in various formats, okay, targeting, and it is available targeting the pole genes or the ENV genes को target करने वाले बहुत सारे formats में RNA detection test available है, and those various formats are, we are having the reverse transcriptase polymerase chain reaction, that is nothing but an RT-PCR के format में हो सकता है, or it can be as a branched DNA assay, something called as your NASBA, that is nucleic acid sequence based amplification, and we also have your real time RT-PCR for estimating the viral load, guys. We can make use of all these particular formats are available for the RNA detection, guys. Okay, now what are the uses of this test? Okay, so RNA detection, as I said, it's a confirmatory test. So please remember, it's a gold standard test. Why? Because it is the most specific as well as the most sensitive test available for confirmation of the HIV diagnosis. It's the gold standard. So that's the first important use. Second thing, it is also used for the diagnosis of HIV during the window period. As I said, I will be describing what is window period in the upcoming slide. Just for the timing, remember that P24 antigen test used tha, and this is the second. Okay, this is another test that we can use for the detection of HIV during the window period. Third thing, it is used for the viral load monitoring, as I just highlighted over here. Viral load estimation के लिए we have the real time RT-PCR, तो viral load monitoring के लिए है. It is also used for typing. Typing का मतलब पता है क्या है? It simply means that this RNA detection test जो होते हैं, PCR based methods जो होते हैं, they are capable to differentiate between your HIV-1 as well as your HIV-2. It can differentiate, and further it can differentiate their genotypes, okay, and their subtypes को भी ये कहीं ना कहीं differentiate कर सकता है. And lastly, this test can also be used for the detection of drug resistance genes. Clear? Last confirmatory test, that is the viral DNA detection test. And this viral DNA detection, whenever I say DNA detection, one of the things you should always remember that it is used for the diagnosis of the pediatric HIV guys. ठीक है, pediatric age group के अंदर HIV detection के लिए the best or the most recommended test is nothing but going for a viral DNA detection guys. Apart from this thing, it can be used for the detection of the latent HIV infection or from the active viral transcription. ठीक है, it is also used for the diagnosis of HIV during the window period. ठीक है, तो window period के P24 antigen, viral RNA detection, viral DNA detection, these are the various tests that we can use for the diagnosis of HIV during the window period. I will be explaining what is the window period, but just for the time being, remember this thing. And other uses are your viral load estimation and genotype detection के लिए भी we can go with this method. Okay. So we are done with something called as your confirmatory test. So we so far I've described the screening test, the supplemental test, and now the confirmatory test. Let's have a look on these non-specific or the immunological tests that were available. So in this we are going to look for the CD4 T cell count. Okay, what do we mean by the CD4 T cell count, guys? So in this test, the method that we are using is called as the flow cytometry. So we are making use of the method flow cytometry पे based होता है CD4 T cell count. This is how you are going to estimate it. Okay, and the use of this test is for assessing the risk of opportunistic infections, also for initiation as well as monitoring the response of antiretroviral therapy. Now please remember this point over here that I'm highlighting, that is initially the initiation of antiretroviral therapy was based on the estimation of the CD4 T cell count. But this was the older idea. But right now, according to the newer guidelines, guys, it is that irrespective of the CD4 T cell count or the age or the gender or the stage of the disease, we have to start the patient of HIV on the antiretroviral therapy. Okay, this new guidelines and all these things we are going to describe under the treatment wala part. But for the time being, this was this initiation of ART was you can say kind of an older indication for doing a CD4 T cell count, guys. Okay. So this was one of the non-specific findings. Another thing to remember is your hypergammaglobulinemia. Okay, I mean to say, इसका मतलब ये होता है that if there is presence of some abnormal proteins, okay, some abnormal proteins का presence है, abnormal proteins like your neopterin, beta 2 microglobulin or soluble IL-2 receptors, okay, if this is present, so it's an indicator that the patient is having an HIV infection. Why is the question? So the answer is very simple, because any HIV activated or infected Th1 cells are going to produce the interferon gamma or the interleukin 2, that is IL-2 or INF gamma का production करेंगे. So any HIV infected Th1 cells, okay, produces this interferon gamma and IL-2, which is going to stimulate the PBMC, that is, it is going to stimulate the peripheral blood mononuclear cells, and which in turn is going to produce these abnormal proteins, and which is producing these abnormal proteins, neopterin, beta 2 macroglobulin and the soluble IL-2 receptor, guys. Okay, and that is why they are stating that is HIV के अंदर presence of these abnormal proteins is one of the indication that the patient is having HIV. Clear with these important findings? Okay, let's shift ahead. And so with this thing, we have covered all the laboratory diagnosis. All these following tests are covered in detail, guys. Okay, so we are done with laboratory diagnosis. Now we are going to have a look on some other important related topics here, जैसे कि prognosis of monitoring of HIV, which all tests we can use. ठीक है? Then the diagnosis of HIV in the pediatric age group and in the window period. ठीक है? So let's have a look on that thing. Let's first describe the prognosis or monitoring of HIV. Now, see guys, in this particular topic for monitoring of the HIV or for knowing the prognosis of the HIV, these are the following tests that we can make use of. Okay? Of which the most commonly used test is which one? The CD4 T cell count. The most consistent and the best tool at present for the prognosis or for monitoring of the HIV is nothing but going with the HIV RNA detection, guys. Take care, doing a viral RNA detection. It's a gold standard test for HIV, yes or no? So that is one of the tests that we can do. Next, apart from these two, we can make use of the P24 antigen detection, or we can look for the presence of those abnormal proteins, that is neopterin and the beta 2 macroglobulin levels को assess कर सकते हैं. Now, what about viral antibodies, guys? Okay, can we use the viral antibodies for prognosis or for monitoring of the HIV? Answer is no. Why? Because of immune complex, okay, because of the immune collapse during the late stages, the antibody levels are a bit inconsistent and variable. And it is because of this reason, guys, these viral antibody levels are not reliable for the purpose of prognosis as well as monitoring of HIV, guys. Clear with this thing? Let's go to the next topic, that is diagnosis of pediatric HIV infection. Okay, so let's now pay attention. I'm going to explain you a concept over here. So over here, see, this is something that we know. That is from the mother to the fetus, okay, to a neonate or to a newborn baby, guys. There are some antibodies that are transferred. And from the mother to the neonate, some antibodies are transferred. Yes or no, during the intrauterine life, this thing is happening. And one of the antibodies that is transferred from the maternal end to the fetus is the IgG antibody. Yes or no? What is the role? Why these antibodies are going? Because it is going to provide, it provides these maternally transferred antibodies, it's providing immunity to the newborn. It provides immunity to the newborn for the initial 18 months, because after 18 months ये maternal antibodies जो होती है, they kind of disappear, guys. Okay, so this is happening. So this is like a very basic thing that we know. Now let's understand, suppose this particular neonate is having HIV. This neonate is having HIV, and for detection, guys, we are performing a screening test. Okay, when I say screening test, which all tests we can remember under screening test? We can go with an ELISA, or we can perform a rapid or a simple test. Okay, we can go with a rapid or a simple test perform कर सकते हैं. And both of these tests are going to detect these are both antibody detection tests. They are going to detect the IgG antibody, है ना? तो ये दोनों के दोनों जो टेस्ट होते हैं, they are detecting the IgG antibody. Yes or no? Now pay attention to this thing. So suppose a neonate hai, okay, who is less than 18 months, and I'm performing this screening test for HIV detection in such a neonate or in such a newborn baby. What will happen, guys? Take care. Now in a neonate, you are having this maternally transferred IgG antibody hai, and the baby would also be having his or her own IgG antibody, which is developed against the HIV infection. Now, because of the presence of two antibodies, okay, two IgG antibodies, that is the maternal one and the baby's own antibody, this particular test, okay, ELISA and rapid simple test, they are unable to differentiate this antibody, and therefore we cannot make use of this test. Okay, so that is what is written over here, guys. That is, so whenever we are diagnosing the HIV in a pediatric age group, guys, so the routine screening methods जो होते हैं जैसे कि ELISA or rapid or simple test, they are not used in a younger baby. So I can simply say, if you are having a baby, okay, who is less than 18 month wala baby hai, so in such a baby, guys, these screening tests that we are performing, ELISA or rapid test, they are unable to differentiate, okay, unable to differentiate between the maternal and the baby's IgG antibodies, है ना, differentiate नहीं कर पाएगा, and therefore this test is not useful. लेकिन after 18 months of age, the maternal antibodies disappear. Maternally transferred antibodies are going to disappear, and therefore these tests can be performed. Okay, this test ELISA and all can be performed. Clear? Okay, now apart from this thing, there are other methods also. Directly हम screening test अभी मैंने बताया ना कि एक newborn baby में screening test under 18 month है, so it is not very reliable, not useful because maternal and baby के बीच में differentiate नहीं कर पाएगा. The best test, one of the most recommended method for pediatric HIV diagnosis, as I already said you, is your HIV DNA PCR. Going for the detection of the viral DNA is very important. Okay, so the baby is tested for the HIV DNA at 6 weeks of age by collecting the DBS. Okay, what is DBS? DBS stands for a dry blood spot. Okay, so you have to collect a dry blood spot and we have to perform the HIV DNA PCR on it. If the results comes out to be positive, okay, then we have to repeat the same test. We have to repeat the same HIV DNA PCR for reconfirmation, and then only we can report the patient as positive. Then only we can report the baby as positive, and thereafter we have to start the baby on a lifelong antiretroviral therapy. So that was the details of HIV DNA PCR. Clear? Then other test that we can do is we can go with the RNA detection, है ना, viral RNA को detect कर सकते हैं. We can also go with the P24 antigen detection test, and as I said, that is after 18 months of age. We can also go with the IgG ELISA test. Clear with the diagnosis of pediatric HIV infection. The next topic, that is the window period. Finally coming to the window period. What is window period? Is nothing but the time interval between the point of exposure to HIV and the appearance of the detectable levels of antibodies into the serum, guys. Okay? That is what is called as the window period. And what are the tests that we can use for diagnosis of HIV during this window period? Okay, so we can make use of the very important test, that is your HIV RNA detection test कर सकते हैं हम लोग, है ना. HIV RNA detection test by going with the RT-PCR, reverse transcriptase polymerase chain reaction को use कर सकते हैं. It is the best method, guys, and it will be detecting the HIV का RNA that is within 10 to 14 days after infection detect करके दे देगा. Then we can also go with the P24 antigen detection test. Okay, P24 antigen detection test, which is the method. Please remember, we know that detecting of P24 antigen less sensitive is 30% की sensitivity होती है. And as I said you, the fourth generation ELISA kit, it is capable of detecting both the antibodies as well as the antigen. है ना, it is using the monoclonal antibodies for the detection of the P24 antigen. हमने वो टेबल में देखा था, yes or no? And this is going to detect the HIV antigen within 12 to 26 days after infection. So while describing you P24 antigen detection test, I already said you that the P24 antigen becomes detectable only after 12 to 26 days after infection. So this is also one of the tests. Next thing is about antibody detection, guys. ठीक है? So please remember, antibodies ना आपके infection के 2 to 8 weeks के बाद it will appear in the blood, and see, it is just appeared in the blood and it is going to become detectable. It becomes detectable only after 3 weeks to 12 week के time के बाद it becomes detectable into this thing, guys. ठीक है? And for antibody detection, we can make use of the third generation ELISA test over here. The third generation antibody detection test can be used with high sensitivity, and within like as low as 22 days के अंदर you can detect the antibodies over here. So that was all about the diagnosis of HIV in the window period, guys. Okay. So we have covered all the important topics. We have covered the lab diagnosis as well as the 3 related topics are also covered. So that is it for this session, guys. If you found this content useful, then do like, share and subscribe to the channel, that is AMS MBBS Lectures. Thank you so much for watching. And if you have any questions or queries, do comment down. I'm there to answer it. See you all in the next one. Bye bye.